Over 1 million Americans lost their lives to COVID.
Cases once again are on the rise.
Over-the-counter tests are available for free.
Stay safe.
Know your status.
Test before you gather.
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 TBYG. TBYG.
TBYG.
3 simple ways to order free at-home tests. Federal, state, and local.
This is part 2 of our tablet training workshop. And this workshop is courtesy of Aging and Disability Services, Harborview Medical Center, and AARTH. And it was a pilot program on tablets using the Samsung Galaxy A tablet. Everyone there, King County Tablets for Seniors pilot? Perfect, perfect, perfect. Okay, I'm Twanda Hill. As Jasmine told you, I do a lot of work around town, but I also do a lot of work specifically for AARTH. Today's agenda, we're going to review the Zoom basics, MyChart and telemedicine visits. And so let's talk about Zoom. Everybody, any questions from yesterday's people about Zoom? Just go ahead and put them in the chat box or raise your hand. But Zoom is just a video chat. We're all on it now, so most of you know how to access it. What you don't know is that you can have a free account or you can have a paid account. On your free account, you can actually host up to 100 people, but you have a 40-minute maximum time for the meeting. Now, if you're just doing a meeting one-on-one, so Miss Charlotte, if you were talking to Jasmine, then, and you guys could do an hour, 90-minute long meeting because it's just one-on-one, and you can do that with a free account. I remember telling you to create a Zoom account. They asked you for an email address. You can go right to zoom.us to create your Zoom account. And one of the benefits of having a Zoom account is that when you're having a meeting and you sign in, your profile is consistent. Your name is there. If you turn your camera off, there'll be a photo of you from your actual photo will show up instead of saying your name if you place that in there. So there's advantages to having an account, regardless of if it's free or paid. If you already have an account, you just go to zoom.us, sign in to actually sign into your account. And then remember, when it comes to joining a meeting, there are multiple ways. Just like in life, you can skin a cat 3 different ways. You can join a meeting by typing in the meeting ID. If you have the personal link name of somebody, you can type that in, or you can join with an invitation link. And so that's how most of you joined in, because on the reminder that you got, we set it up so that you could actually just click on that button and it brings you right in. If you want to update your profile, remember to look at your settings, go to your settings and select My Profile. On there, you can add your photo, you can change your photo. If you need to change your display name, update passwords, etc. If you want to create a personal meeting ID. So a lot of times I have meetings, I have some standing meetings on events that I'm working on. And when I do that, I don't actually set up a new Zoom link for each meeting. I use my personal meeting ID number, which is the 206-248-6072. And I use that because it's my office phone number, and it's easy for people to remember. And you can see right here, licenses, it tells you that I have a user type, it's licensed versus a free account. Meet and chat, new meetings, You can, if you want to set up a new meeting, join a meeting, schedule a meeting, and on your device, if you want to share your screen, this is where you would do so. Okay? And I actually put this presentation together back in July, and those were the meetings that I had listed. And remember, my tablet and my account is connected through Google, and so it actually syncs. So even though I have some non-Google meetings in here, they are all listed together. So I'm always up to date on where I'm supposed to be, regardless of what calendar I'm looking at. Settings, meet and chat, meetings, contacts. And so these are just some other icons at the bottom of your screen on settings, and you can go ahead and I encourage everybody to hit those buttons, play around, see what they do. Join a meeting. If you want to join a meeting, here you go. You type in the meeting ID number, or if you had the personal link name, you would join there, and then you click join. If you want your audio turned off while you're on your tablet, you can go ahead and turn off your audio. And then I advise you to go ahead and connect with the Wi-Fi for audio. If you choose the dial in, what it's going to do is it's going to give you an opportunity to dial in using a phone number. And you can do that if you need to. That sometimes for some people might be a cleaner connection. Turn the camera on and off. So you can tap on your screen bar, on your screen for the toolbar to appear, and make sure your microphones and your speakers are not muted. And if you need to click unmute on the toolbar, you can do that, as well as make sure your video is started. So if you want to be seen and you want to be heard, okay? And I'm going over this pretty quickly because remember, we did a lot of this yesterday. And so starting a test meeting. The great thing about this is that if you have a test meeting, if you join a meeting test, it will allow you to actively try out the different icons on your computer. Okay? On your tablet, I keep saying computer, but it's your tablet. Any questions about Zoom? One of the things we talked about is the virtual backgrounds yesterday. And on the Samsung Galaxy Tablet A, you cannot upload backgrounds. And so, like I said, some tablets you can, some you can't. So this one you can't. But remember, we also talked about unsplash.com as a way to go in. You can do a search in your browser and you can actually look for free virtual Zoom backgrounds. And then we have the videos that are also on the AARTH website from the digital equity trainings that is an actual Zoom class and understanding Zoom on the PC or a laptop. Because remember, with the tablets, you're getting a modified version of the operating system. So that means a lot of your apps won't be as robust as they are on your tablet, on your laptop or computer. They'll let you do certain things, but not everything. Okay? Y'all are real easy. Okay, so let's talk about MyChart, because that's what we wanted to focus on today. So MyChart, what is it? It's a patient portal. So whether you're at the University of Washington or whether you are at Pacific Medical Center or Swedish, most hospitals all have a MyChart portal that allows you to see your medications, your test results, any upcoming appointments, bills, and it lets you see all of this in one place. And this happened because people needed to be able to go to a central spot to get this information. And I know at one time, different hospitals actually are using similar systems. So if you're at the UW, they were able to see what was happening with me at Pacific Medical Center. So, but the MyChart is just a patient portal. So in this workshop, we're going to talk about the UW Medicine and how to access MyChart for UW Medicine. So remember, on your tablet, you have a search bar. So if you type in the UW Medicine MyChart login into your search bar and hit enter, it's going to bring up this next screen. But remember, the other thing that you could do is what? Select the microphone and speak that into your browser, your search bar browser, and it will come up that way as well. So on the tablet, this is what you're going to see from UW MyChart, Welcome, Seattle Cancer Care Alliance. All of those things are right there for you, you to see. You would go in on your tablet, you would enter your username and your password, and then select sign in. If you forgot your username or you forgot your password, it's going to, you click on those buttons and you enter, they probably have you enter your email, maybe your birth date, and they'll send you an email with instructions on how to reset those. If you're a new user and you need to sign up, you go ahead and sign up. And then you also have to request an activation code. So it's very, very simple to access it from your tablet. So one option that you do have in the portal, actually, so on the tablet, it's very easy to see what you can do. So if you need to send a message to your doctor, actually at the very top, if you need to schedule a COVID-19 vaccine, you can go there and click on that link. Because remember, these things are all hyperlinked. Remember those words from yesterday. So you can message your doctor, request a prescription renewal. So many times we think that we have to call into the office, but if you're in your portal, you can go right into the portal and request it. If you have a bill that needs to be paid, if you took some tests at your last exam and you want to see what the results are, you can go in, as well as you can manage your appointments. So if you have to schedule an appointment or cancel, or you can't remember what's the date of your appointment, you can go in and look right there. So all of that stuff right at your fingertips. And then the cool thing is that if you are doing a telemedicine visit and you have that schedule, if you click on video visits, it will take you in real time to your scheduled visit with the doctor. Any questions?
I was going to ask about the telemedicine visit. Is that the same thing?
The telemedicine visit is the actual visit. The MyChart is just the portal that allows you to schedule your visits. It allows you access to your records. And in the portal, it will take you directly to your scheduled telemedicine visit, which we'll talk about in the next session. But good question, Ms. Callie. Thank you. Mm-hmm. Anybody else? So remember yesterday when we were talking about the elements of a tablet, I showed you how you could actually download applications. And if you go to the Google Play Store, you can actually find, and you do a search for UW Health MyChart app, and you'll see this little folder with the heart, and that is the MyChart app. You can download that directly onto your tablet. And then instead of going through the process on the web browser, you're actually inside the app. And you can download this app whether you're on a tablet or you're on a smartphone. So when you go into the MyChart app and log in, this is what it looks like. You select the option to begin your video visit. Real simple. when you select begin visit, this takes you directly to Zoom and it will start your Zoom account. And Zoom's going to ask you for your name, your first and last name, and then more than likely you'll get placed in the waiting room while your healthcare provider gets ready to join you. Okay? So it's real simple. That's the whole purpose of apps, is to make it a lot more simpler than having to remember the browser login. You just go to the app, log in, select begin my visit, and it takes you there. So, and if they don't show up right away, don't worry, they are coming. So just be patient and stay online. So if you do not have the MyChart app, when you do this through your browser, before the visit, they're going to send you a text with a link to your phone or tablet, just as a reminder that you have this telemedicine visit scheduled. Follow the link to get to the Zoom website. Choose to use Zoom Cloud app to open the link if it prompts you to do so. And then again, Zoom will ask you for your name, first and last name. It'll place you probably in a waiting room. And then just know, like I said, it may take a few minutes for the provider to join. It's no different than when we're at the normal doctor's office. I've never had a doctor come in immediately after the nurse left. I usually have to wait a few minutes. So just stay online and be patient. Any questions? Y'all all got all of that. Well, that's good. Okay, so let's talk about telemedicine visits. And so a telemedicine visit is a way to get the healthcare you need when you cannot come to the clinic. So COVID did a number on all of us. I was not feeling good a couple years ago, and I couldn't go to urgent care. They said, well, go to the emergency room. And I'm like, there are people that are sick there. I don't want to go to the ER. And it ended up, it was a rash that I had on my neck. And so I got the option to do a telemedicine visit. I thought, perfect. Believe it or not, during that visit, before the visit, they had me take a couple pictures of the rash so they could see what the bumps look like. And I set up a telemedicine visit and they were able to evaluate it and subscribe a cream prescription. Done. So I think that this is a great way to access medical treatment. It eliminates all of that traveling and back and forth. And, you know, a lot of times you go to the hospital, there's so many germs there that you end up getting sick. So telemedicine visits are the new way to go. Now, we know you can't do every visit by telemedicine, but there are a lot that you can do. So let's talk about some helpful tips to get you ready for the visit. So you want to be prepared. So before you go to the, before you log in, you want to have a list of topics you would like to discuss with your doctor. And so it's no different than normal. You want to be prepared. If you have questions about your cholesterol, if you have questions about certain prescriptions you're taking, hopefully you have a notebook that you're just keeping a list of those questions anyhow, so that when you get to speak to the doctor that you are able to actually have that conversation with them. Next, what do you need to have? You want to have the clinic's phone number on hand should you have technical issues or get disconnected during your visit. So nothing is worse than all of a sudden you got disconnected. I'm assuming they're going to call back. They're assuming you're going to call back. If you have the phone number on hand, you're able to go right away into the system and call them. And with the UW at the end of this presentation, they actually have a technical phone line that you can call if you have need help with setup or you have any technical issues. So having those numbers nearby are handy. So let's make sure your device is plugged in and fully charged. How many of you have actually had an opportunity to you're on a call, you're doing something, and next thing you know, your battery is about to die. And so you want to make sure when you're getting ready for your telemedicine visit that you are set up and that you are ready to go, and that your device is plugged in or fully charged. Okay? When you do your visit, you want to be in a quiet place with good lighting. So as I was setting up today, I said to Jasmine, I'm going to put on my selfie light. And I encourage everybody, we've been in COVID over 2 years, we should all have selfie lights. And the reason you want that selfie light is so that you are seeing clearly. You know, we're Black and brown people. Sometimes we're not going to show up in the best light, or if you're in a dark corner in your house, you're just going to blend in. So we want to be able to see you. And I like to practice it whenever I'm doing meetings, whether I'm hosting the meeting or participating. I just like to show up in the meeting correctly. Clips on, okay?
Oh, great.
And it plugs directly into a USB port.
Oh, into a USB port. Okay.
Yes. And so you're always going to want your light behind you, facing you, so that it's clear. If it was behind me, then I would be blinding you. Isn't that cool? That's
well,
great.
Let us see it. Yeah.
Yes. And I'm talking position too. Make sure you position yourself so that the main light source is in front, lighting up your face. So even if you had natural lighting, if your window is behind your device, okay, not in front. And so, you know, make sure you can position yourself so that everything is clear. If I was on this telemedicine visit, what I don't want is to be talking to the doctor like this. You know, I don't want to be talking, you know, those are my favorite ones, when I can see everybody's foreheads, you know, or we just see their hair. So take some time to position yourself and make sure that you're lit correctly, you're in the center of your screen, and that you're comfortable. Set your camera at eye level. So if you have a tablet, you might have to stack some books up, you know. Some of the selfie lights, depending on what you get, this one has a little clip on it, and it's more so for phones, but that's how long ago this was purchased. They now make them where you could actually connect your tablet to it. We know how to do books, lean it up on a sugar, the 5-pound sugar, container bag. You just want to do whatever you can do so that it's eye level, so it's easier for the doctor to see you and engage with you, because we're online, we still want to look at you and talk to you, so we feel like we're engaging and I'm understanding and hearing what you're trying to say. If you need to use headphones, go ahead and do that. Remember, on the tablet, on that Samsung Galaxy tablet, I showed you where the headphones go in. And so then you're going to find that little button and you just stick right here. You just stick the headset in if it is a wired headset. If you have a wireless headset, then remember you're going to go to your Bluetooth and connect it that way. And that's great. It's just better to hear sometimes, and then you don't have to have everybody in your business. I suggest you start your visit at least 15 minutes early. And just because you want to give yourself time. Even today, I came on and I like I said, I switched to my laptop versus my desktop. And I have the little stand and it clicks, and it was all uneven. And so I'm trying to get it. So, I want to make sure that I always give myself time to be prepared and be ready, so that when we get to the next, when we get to the actual scheduled time, we're ready to go. Because we all know it's one thing for the doctor to be late, it's another thing for the patient to be late. And so And if you're the first patient of the day and you're late, you're going to throw off the whole day for the rest of the people. Somebody's going to be scrambling. So give yourself that time to get through the process. So just remember, when it's time for your visit, begin the video visit on MyChart. If you don't have MyChart account, you'll be sent a link. And when your visit starts, they are going to actually ask you as well for an alternate contact number in case you get disconnected. And so this was probably the quickest class we taught. I think I was going to do more Zoom on this one, but because we did it on the first one and reviewed it on the second. But anyhow, does anyone have any questions on telemedicine visits?
Feel free to drop those in the chat or take yourself off mute and let us know.
And then if you are a UW medicine patient, the 206-520-5100 is their service desk, and they are there to provide support in any way that you need to help get you started. Let's see what's happening in the chat.
I have a question.
Yes.
I'm viewing with Cheryl. My question is, on my monitor for my desktop, it doesn't have a camera. And what type of a webcam would you recommend to attach to that?
I'm not partial to a particular one. I would actually get what you can afford. You know, what your budget wants to handle. You know, they have cameras as inexpensive as, $20, and they have them for $200. You know, the higher up you go, the higher resolution you're going to have on the camera. And so that's something to consider. Yeah, I actually have 2 desktop cameras and both of them are different. I don't know, Paul, Paul would be somebody, would you have a recommendation on what features they should look for on the camera?
Twanda, definitely agree on budget concerns. Got to make sure that the connection to your computer, which typically be USB, more than that, the resolution. So I have a USB camera, but it's high def. So 1080 by 1090 or whatever. Make sure you get that. Anyway.
So really what you're saying, Paul, though, is you want a high definition camera. So the high def, the USB connection, those are going to be what helps you best with the best resolution.
Yes.
So, but if and it's price specific, because if you have a inexpensive camera, you're not inexpensive laptop or computer, I wouldn't spend a whole lot of money on the camera.
Okay, thank you.
You're welcome. Who else has a question?
Oh, one other question.
Sure.
The other day you had mentioned a Google account. Is Google Chrome and a Google account, that's one and the same, or is that different?
They're different. So Google Chrome is actually a browser. So that's the browser that we use when we're accessing the internet. You have Google Chrome, you have Bing, Microsoft Edge, Safari. Those are all browsers. And so Google is the browser. Google Chrome is the browser in the Google series. Okay. When you have a Google account, that means you actually have an account that allows you to access multiple proprietary Google apps in your account. So whether it's an email account, whether it is Google has their own version of Zoom. It's called Google Meets. So having that account just allows you access to those proprietary pieces. It allows you to a calendar. So if you use the Google Calendar and you have an account, the great thing is that it all will sync on all of your devices.
Okay, thank you.
Okay, that's a great question. Miss Rena?
Okay, so one of the things we were talking about, the selfie lights.
Yes.
And Twanda, I love how yours is, but also see how mine is showing up in my glasses?
Mm-hmm.
That can be a distraction during the Zoom call. So like I'm trying to, since I've moved mine, now I'm trying to readjust it so that it's not in my glasses. because it can definitely be, because I find myself looking at the little circles on people instead of paying attention to them. So
Yes.
I just wanted to share that always be mindful if you're wearing glasses that it's not reflecting out of your glasses, because it can be very distracting, like I am right now.
Do you see too? I changed my lighting.
Me too.
And so it sits differently with different lights. And then if you find that you're going to be doing a lot of these types of meetings and call, like with everything, we know that we just have to update our system and get one of the big lights that just has a little softener on it, you know, little filters, you know.
You look like a postcard. You look so pretty.
Thank you. And you know what, actually, because, and I didn't do it today, but I prefer my glasses, but I do a podcast. And when I do the podcast, I actually wear my contacts.
Yeah.
Because it does, you know, but look, we're seniors. We got glasses. Anyhow, good question. Who else has a question?
Cheryl has a question.
Okay.
In the beginning, you mentioned about the 40-minute and the 90-minute. Can you please explain that again?
Okay, there's not a 90-minute, there's just a 40-minute. So if you have a Zoom account and you have a free account and you want to have 2 people or more on the Zoom call with you, the maximum time it will allow you is 40 minutes.
Okay.
If you have a free account and you're just doing a one-on-one call, then you could go for 90 minutes. You can go for an hour, 2 hours. There's no time limit on it. But if you're doing more than one connection, you have a 40-minute maximum, or you have to get a paid for account.
Okay, thank you.
You're welcome.
Oh, I have a question about that. Can you use the 40-minute free and then switch over to your paid? Or did you say it's unlimited if you buy an account?
So how would you do that?
Oh, I don't know. That's why I'm asking the question.
No, because if you have the 40-minute account, now I have seen some folks in a meeting say, okay, I'm on a free account, so on 40 minutes, when the meeting ends, our 40 minutes, I'm going to resend you another link.
Oh, that's right. Yeah.
Yes. Girl, you were on that call too.
Oh. Okay, I just remembered. That's right. Thank you.
Yes. So now you know. So, anytime the lowest paid account allows you to have up to 100 participants. But here's something to think about. Zoom is needed for the telemedicine visits with the portal for my portal. When we go to Facebook and do the Facebook training on Friday, they have their own version of a video chat program, and there's no limits on it. You just get on it. There's links and ways to do that. If you have a Google account, Google has their own video chat program called Google Meets, and you can set up a Google Meet and do the same thing, unlimited people. I never understood what the big piece was with Zoom. We just went Zoom crazy because there are so many. Freeconferencecall.com now does video. There are all of these programs that have video chatting for free, but as a society, we decided Zoom was the answer. But yeah, I have a Vonage phone system and I can have up to 300 people for free. And my son said, Mom, nobody wants to log in like that. Well, it's free. So yeah, so do know that you do have other options. If you have an organization or a group that you're the lead for and you want to do video chatting with them, you don't have to use Zoom. You could do, like I said, freeconferencecall.com has video as well, and they give you an option. They say, hey, if you're using it and you're able to make a donation, make a donation. They don't even have a set price for you. So yes.
So, Twanda, can you send us those alternative methods?
Yes.
Thank
I'll
you.
make a note. note to send alternative methods. Just, we always have options. It's, like I said, there's more than one way to skin a cat. And that's what makes teaching classes interesting around technology, because I can show you one way of doing things, but I can guarantee you there are a couple other ways to actually get to the same point. This was great. Well, I thank everybody. Unless you have more questions, we wrapped up pretty early for today. And
I just posted in a link on the chat. Apple is giving out free classes on iPad, and it's going to be on Thursday, actually. So click on the link, and you can sign up for it. And if you go to the Apple Store, I'm sorry, Callie? Miss Callie? So Apple Computer Online is giving free lectures on Apple iPads. It's going to be Thursday, and it's online. But if you go to the Apple Store, they have classes all the time. And so you can look and see.
Oh, thank you.
Sure.
Okay. Full of information.
Thanks, Paul.
You guys are welcome.
I guess I need to take a picture of all of this.
To save the chat.
How do I save the chat?
Chat window, down towards the bottom right-hand side, you'll see a square, a smiley face, and 3 dots, horizontal dots. If you click on the dots,
I see the smiley face. I don't see the dots.
Okay. Maybe you need to open up that window a little bit bigger. But those 3 dots, if you click on it, a thing will pop up that says Save Chat.
Oh, that's great. Okay, I'll look for that.
Okay.
Uh-oh.
Yes, and remember what I told you about those chats. Who remembers what I said about the chats yesterday?
So if you say something to the chat, the person can see everything. Everything.
The host can see everything.
So I have a question though. Where does it save it to?
Oh, it's going to be on your desk. It's going to be on your desktop more than likely, and it is. Mine just pops up after I close out and says, "Here's your saved chat."
Okay.
And so, but it's usually under. Is it under My Documents, Chats, or Zoom? Yeah.
Well, it depends on what system you're on. If you're on a PC or a Mac, it'd be kind of different. And
on my PC.
On a PC, it pops up under My Documents, and there's a subfolder that says Zoom.
Okay.
It'll be there.
Yeah.
That's where, and also if you record something and it says save, it'll save into that same
My Documents, unless you told it to save it to the cloud.
Right. And you know what, Twanda? Me and the cloud have issues. So anyway, that's all I'm gonna say. I'm in the process of learning more about that.
There's another class, Jasmine. How to work in the cloud, because so many of us think, oh my goodness, I don't want to put in the cloud, or who knows where it's going. But let me tell you, if you're at home today and you're at your grandson's tomorrow, if your stuff is in the cloud, it makes it easy for you to access that information. I mean, the one trip I went on, I'm like, oh, I'm only gone for a short time. I'm not going to take my laptop with me. My cousin asked for a picture of my grandmother for his wedding mantle table. And so I was able to go into the cloud, download the photo, and send it to the store and have it printed for him. So the cloud does have its advantages.
That's a good idea. That's a good one. That's a good
and understanding how to make it work for you. And like I said, I work off a desktop. I work off of a laptop. I work sometime off of a tablet, not much, but I just always like to be able to, a lot of times if I'm traveling, I can be on the plane, somebody's like, oh, I need a file from you. I'm able to go right into my phone and access my file and send it to them. So it does have its advantages.
Okay, Jasmine, we'll be looking for that. I'll be looking for that.
One other thing that's good about the cloud too, for those of us that travel for work, something were to happen to your laptop, because I hate going through TSA with my laptop because people can come along and pick it up, but you are safe because you are able to get to it because everything is in the cloud. Or if you spill coffee on your laptop, so everything's in the cloud.
if your computer crashes or you get a new computer and everything is on My Documents, it has to literally be transferred from one computer to the next, where if it's in the cloud, it's in the cloud. You can bring it down as you need to, and it helps you with your storage space. One of the things too, a lot of folks are using Google Drive as a way to use their cloud.
That's another one.
And one thing is they give you a limited amount of free space, but you can actually purchase more space. I think it was like $3. Was it $3? Maybe $20 for the year to get yourself like a terabyte of space, so you really have enough room to do what it is that you need to do.
So
see, tons of resources. There are tons of resources that are out there. You know, AARTH start doing the trainings because we recognize in our community that there was such a gap. And we wanted to make sure that we could close that gap by providing tools to do it. And so, but as things are opening back up, if they're seniorplanet.org classes, come on, that sounds like something everybody could do every week. So, there are definitely options.
I'm sorry, but I want to add a caveat to that. Sometimes when we're doing these classes within our own community, it seems a little bit more personal. We are more apt to ask questions. That if we're in such a large class, per se, I might not ask the questions. But here I feel safe asking the questions, even though it may sound crazy. So, Jasmine, come on, girl. So,
yes. That's so true, Rita. And I feel like y'all are all my friends, and I just love it that we can connect, even though I'm not in the city, you know, yet. And so it's just great to see everybody's faces and hear the voices. So, so we definitely will keep that in the back of our head. And it really is about funding for us, you know. It's about funding. AARTH, that's how AARTH works. Every project has a grant that it's attached to. So